Hello friends, welcome to part 3rd of cardiomyopathy. So in part 3rd of cardiomyopathy, we are going to discuss with the sign and symptoms and its diagnostic evaluation. So friends, if you have not yet visited to part 1st and 2nd of this cardiomyopathy, so I request you to please visit to part 1st and 2nd so that it will be easy to understand this part 3rd. Okay. So in part 1st of cardiomyopathy, we have discussed about the cardiomyopathy term. Means there is some pathological, there is some disease condition into the muscles of our heart, due to which our heart is not able to work in a proper way. Okay, there is insufficient amount of blood is reaching to our whole body. Okay, so cardiomyopathy means there is some disease condition happens in our heart muscles. And in part 2nd of this video, we have read 3 main types of cardiomyopathy. Number 1 is dilated. Dilated means when there is bulge out, when there is dilation into the chambers of our heart. So due to this dilation, there will be weakness and thinness in these muscles. And again, our heart will not work, or our heart will not able to contract in our proper way and will not able to send the blood to our body. Next, we have hypertrophic. Hypertrophic means when there is thickness in the muscles of our heart. Then, due to this thickness, our ventricles will not able to relax in a proper way, and there will be less blood will be filled into our chamber. That is called as diastolic failure. Next, we have discussed about that restrictive cardiomyopathy. Restrictive means when there is some strictness, when there is some hardness, means rock-like formation into our muscles. Then again, it will not able to relax, it will not able to diastole, and there will be less blood will be filling into the chamber. So I have divided the sign and symptoms in this category. You can also write the sign and symptoms together. So what will happen if there is some cardiomyopathy happens in the right heart? Okay, if there is some disease condition happens in the muscles of the right side. So before discussing the sign and symptoms, let's start with the function of this right side. So from the inferior and from the superior vena cava, the blood comes into the right atrium, and from the right atrium it goes into the right ventricle, and through the contraction force, through the systolic process, it goes into our lungs for the oxygenation. This is the function of our right side. But if there is some pathy happens, if there is some disease condition happens in the right muscles, then what will happen? There will be breathlessness condition. Means our lungs are not able to get sufficient amount of blood. So there will be dyspnea condition seen in the patient. Dyspnea means there is difficulty in the breathing. Patient will feel suffocation. Okay, there will be breathlessness condition. Next, we have weight gain and urination. Again, when this blood is not going into the forward direction, then this blood will go into the backward direction. Backward means it will go into the right atrium, and from the right atrium it will again go into our whole body, and there will be weight gain condition seen in the patient. Why there is urination problem? Because this blood is also going into our kidney. Okay, this blood is moving forward and it's going into our kidney. So kidney will make maximum amount of urine, and patient will feel urination problem. They will be urged to urinate. Next, we have edema of feet, ankles and legs. Okay, due to gravitational pull, maximum edema or maximum swelling is seen in the patient legs and feet. Next, we have GI tract ascites condition. Ascites means there is more amount of fluid accumulated into the abdominal cavity. Because of backward filling of this blood, it will go into our whole gastrointestinal system, and there will be more excess amount of fluid will get accumulated in our GI system. Okay, there will be more fluid will be in our abdomen, that is called ascites condition, and more fluid will accumulate into our liver also, that is called as hepatomegaly condition. Next, we have nausea, vomiting. Why there is nausea and vomiting? Because the GI system have been filled with the fluid, and that will create a pressure on our stomach also. So patient will feel bloating, he will feel loss of appetite condition, there will be nausea and vomiting condition. Next, we have left heart. Okay, so again we are going to discuss the function of left heart. Now this oxygenated blood from the lungs comes into the left atrium by the pulmonary vein, okay, and from left atrium it goes into the left ventricle, and by the contraction force, by the systole force, this blood is again distributed in our whole body through the largest artery that is called as aorta. Okay, so what happens if some condition happens, if some disease condition happens in the left muscles, in the left sided muscles of our heart? So first sign, arrhythmia. Arrhythmia means there is irregular heartbeat. Okay, the heart beats in very fast way. Tachycardia, there can be tachycardia condition or there can be bradycardia condition. There can be too fast heart rate or there can be too slow heart rate, because due to this blood is due to the blood, because the less amount of blood is supplying into our whole body. So what will happen? Our sympathetic nervous system will generate, and our RAS system, that is called as renin angiotensin aldosterone system, will generate, and this both system will create an extra pressure and extra effort into our heart, and our heart will try to cope up this condition by doing more contraction or and more by increasing the heart rate. Okay, and one more thing is happening. Our conduction system, our electrical conduction system is also present in our muscles. When the muscles are dilated, when some disease condition happens in these muscles, then our electrical system will also suffer. Our heart electrical system will also suffer, and there will be irregular heartbeat or arrhythmia condition. Next, we have increased heart rate and angina. Again, there will be increased heart rate because our heart have to cope up with increased amount of blood, because the kidney, due to the RAS system, our kidney is trying to retain more maximum amount of blood into our body only, and this maximum amount of blood, if it will remain in our body, it will increase our heart rate by making or by forcing our heart to do extra work. So there will be increased heart rate. And there is angina. Angina means a severe chest pain, because the less amount of blood is coming into our whole body. If our whole body needs a blood for metabolism process, then again our heart is also an organ. It also needs its own blood supply, and this blood supply to the heart is done by the coronary artery. So less amount of blood will be received by our coronary artery, and there will be myocardium damage, there will be myocardium necrosis happen, death of myocardium cells and tissue, and patient will feel angina pectoris, a severe chest pain. Next, we have weakness and fatigue, because our cells and tissue are not able to receive a proper amount of blood, rich oxygen and nutrition, so they will not able to do their metabolic function and will not able to form ATP, form of our energy which our body needs. So we feel the patient will feel fatigue and weakness every time. And there will be syncope condition, because our brain is not able to receive much amount of blood. So patient will feel unconscious, there will be fainting condition, there will be syncope condition. Next, we have bluish color finger and lips. Okay, when less amount of blood is reaching to our finger of our hands and our toes, then there will be some cyanosis, bluish discolorations in the patient finger and legs. And there will be bluish discoloration into the lips of the patient also. Next, we have coughing and shortness of breath, because lungs are not able to receive a maximum amount of blood, and again this blood is also going backward into the lungs, because the hearts are very dilated. It is not able to pump the blood into the forward direction. It will go back into the lungs, and the lungs will be filled with the fluid. There will be congestion happens in the lungs, so the patient will feel coughing, he will feel dyspnea condition, there will be shortness of breath. Now we will discuss the signs and symptoms according to their types. First, there is dilated. Dilated means when the chambers are bulged out, they become very wide. Okay, so due to the wideness, due to bulging out this chamber, again the wall become very thin and weak. So first symptom, there is jugular venous distension, because in dilation the heart is not able to contract. So if the heart will not able to do contraction systolic process properly, then blood will not able to go into forward direction, and it will move again into the backward direction of our body. So we will feel jugular venous distension. Next, there is S3 heart sound. We all know that heart makes two types of sound, that is lub and dub. But why there is S3 heart sound? Because due to the dilation of chamber, there is already a more amount filling is done into the chamber. And if this chamber is already filled, okay, if these chambers are already filled with the sufficient amount of blood, and again the more blood is coming into this chamber, more blood is trying to come up into this chamber, then there will be a sound create due to this filling pressure, that is called as S3 heart sound. Next, we have dyspnea during activity or lying down. Obviously, there will be dyspnea condition because this blood is going back into our lungs also. Okay, so there will be difficulty in breathing. Next, we have weight gain because of backness of blood to our body, weight gain, and there will be palpitation happens. Okay, there is arrhythmia condition. Actually, these signs and symptoms are same. You can write them together also, or by writing them in separate manner also. Next, we have hypertrophic. Hypertrophic means when there is thickness in the muscles of our heart. So, due to the thickness of the myocardium muscles, there will be less space. There will be less space in this chamber. Okay. So, what are the signs and symptoms? There will be S4 heart sound. Because these chambers are very hard, they become very stiff. There is thickness in this chamber. So this thickness of myocardium will create a sound that is called as S4 heart sound. And there is angina pectoris because our heart muscles are not able to receive the sufficient amount of blood for their functioning, so there will be chest pain. Next, we have fluttering or pounding feeling in chest. Fluttering and pounding feeling means a palpitation in our chest. Next, we have restrictive. Restrictive means when the myocardium muscles are become very stiff, very hard, like a rock structure. Okay. Again, there will be jugular venous distension. Okay, there will be S4 heart sound because this rock or this hard structure will make a sound due to the filling pressure into the chamber, that is called as S4 heart sound. And we have weight gain of the patient, then we have bloating and nausea because of GI system have been filled with a lot of fluid and it will create a pressure on our stomach. There will be bloating and nausea condition, then there will be edema and chest pain. Next, we are going to study the diagnosis of cardiomyopathy. How we will do the diagnosis of cardiomyopathy? So, number one is medical and physical examination. So, in medical examination, we will take the complete past and present medical history of the patient. Like we can ask the patient several questions that was he having any surgery in the past? Is he suffering from any metabolic disorder like hypertension, diabetes? Is he taking any drugs or is there any drug allergy he is suffering from? And we will ask the several present questions like is he have any abnormality in his body or is he suffering from any symptoms in his body? So we will take the complete past and present history of the patient. And in physical examination, we will assess the patient from the head to the toe region. Like we can check for the vital signs of the patient like BP, pulse, respiration and all the rates, all the vitals we can check. And in physical examination, the doctor or physician can also auscultate the patient by the help of a stethoscope by checking his lungs and his heart sound. Is there any abnormal or abnormal sound like crackling sound is coming from the lungs or any murmur sound from the heart is coming? Okay. And in physical examination, we can assess the patient by watching also like is he have any edema or swelling in his body? Is any jugular veins distension is there? So you can assess complete physical examination of patient from head to the toe region. Next we have blood test. Why blood test? Because coronary artery disease is also a main cause for cardiomyopathy. So due to coronary artery disease, the heart muscles are not able to receive proper amount of blood. And that myocardium muscle release a certain types of cardiac biomarkers. Whenever the myocardium muscles get damaged, they release a certain types of cardiac biomarkers like myoglobin, troponin, BNP, proBNP and CKMB. So we can check the levels of these cardiac biomarkers. Is there any damage in the cardiac cells? Next, why blood test is important? Because certain types of cardiomyopathy happens due to the viral infection. Like example, myocarditis. It is happened due to the viral or bacterial infection. And in the blood test, you can also check the important vital organs of our body, like how our kidney is performing when there is less output of blood to our important organs like kidney and liver. So you can also assess for the LFT and KFT function. Next we have chest x-ray. So chest x-ray will give a complete cut image of the heart. If the heart chambers are dilated, if there is cardiomegaly, means enlargement of heart chambers, then that can be shown in the chest x-ray clearly. And by the chest x-ray, we can also check the conditions of our lung. Is there any congestion or fluid accumulated in the lungs or not? Okay, so through the chest x-ray, we can check for the pleural effusion, means accumulation of fluid in the lining of the lungs, and we can also check for the pneumonia condition, and we can also check for the cardiomegaly, enlargement of heart. So through the chest x-ray we can see the clear cut image of heart and lungs. Next we have echocardiogram. Echo means sound waves. Okay, so in this echocardiogram test, a sound wave is produced and that sound wave is sent to the heart. Then again the sound waves flow in the backward direction from the heart, and it gives us several images of the heart in the video form. So through the echocardiography we can check the shape, size, structure, rate, rhythm of the heart, and how our ventricles are performing its function, and all the our important valves are functioning or not. Okay, and echocardiogram also tells us about the ejection fraction, how much amount of blood our heart is pumping out. So through the echocardiogram we can also check for the ejection fraction. Okay, means cardiac output. So echocardiogram tells various types of things about the heart, like its chamber size, its wall functioning, how the blood is circulating in the coronary artery, and how our chambers are working. Next we have exercise stress test. It means how our heart is performing its function while we are doing any physical activity. Okay, in normal rate, means in normal lifestyle, whenever we are sitting or we are lying down, our heart is working in a normal way. But what happens when we do lot of physical activity, when we do lot of exercise, then how our heart is tolerating and how much output is our heart is generating. So same thing happens here, means we are checking the stress condition of our heart, how our heart is doing its function while we are doing any physical activity. So in this test, a patient is told to run in treadmill or to ride a stationary bike. Okay, and in that period we will check the heart condition, that how our heart is tolerating this physical activity and how much output it is generating. So we are checking the stress condition of the heart. Next we have cardiac catheterization. It is also known as angiography test. Why we are doing cardiac catheterization? Because the three main coronary arteries are supplying blood to our heart muscles. Okay, suppose these are three main coronary arteries, and if there is any blockage in this coronary artery, then what will happen? That region of the heart, our myocardium region of the heart, will not able to receive blood supply. Okay, so as we know that coronary artery disease is also the main reason for cardiomyopathy. So we are doing cardiac catheterization, means we are checking the condition of this coronary artery. Is there any blockage in this coronary artery or not? Because due to this blockage, the blood will not able to flow at this region of the myocardium. And whenever these myocardium will not able to receive a sufficient amount of oxygen nutrition, they will die. They will die, or there will be necrosis happen in this region of myocardium, and they will form into a scar. They will get converted into the scar formation, and there could be a restrictive cardiomyopathy or hypertrophic cardiomyopathy. So by cardiac catheterization or by cardiac angiography, we are checking the condition of the coronary artery. Next we have electrocardiogram, ECG. ECG is also known as EKG. Okay, it is an electrical record of the heart in a graphical form. So we are checking the rate and rhythm of the heart. So by the ECG, we are placing the electrodes on the patient chest and recording all the rate and rhythm activities of the heart in the graphic form. So through the ECG, we can also check for the previous heart attack, or is there any AV bundle branch, and how our valves are performing its function? Is there any stenosis or narrowing or regurgitation of the valve? So through the ECG, a complete detail of the heart is to be noticed. Next we have cardiac CT and MRI. CT means a computerized tomography scan. So it is an advanced form of procedure in which several three-dimensional X-rays are taken of the heart. So those X-ray can tell all the shape and size and the condition of the myocardium. And in CT scan we can also check out the valve condition, okay, and how our myocardium cells are. Is there any hypertrophy or restrictive cardiomyopathy happens or not? So CT scan will tell all the three-dimensional or clear-cut image of the heart. Next we have MRI. MRI means magnetic resonance imaging. Okay, so because of high frequency waves like radio waves and magnetic waves, they will tell the clear image of the heart. It is same like CT scan. So these CT scan and MRI scan are advanced procedure, advanced test. Next we have genetic testing. Why genetic testing is important? Because cardiomyopathy or most of the heart disease happens due to the genetic, okay, due to the mutation in the genes. So this cardiomyopathy can pass over in the next generation also. So we are checking for the DNA, okay, we are checking for the gene DNA by the PCR polymerase chain reaction process. So through the genetic testing we are checking for any mutation or any change in the gene, because cardiomyopathy happens due to the genetic factor also. It is a hereditary disease condition. Next we have Holter and event monitor. Holter and event monitor is an ambulatory device which is attached to the patient, okay. It will record all the electrical activity of the heart in 24-hour period, okay. In ECG it is recording instant, it is recording instant rate and rhythm of the heart, but in Holter event monitor we will attach a machine to the patient. It is an ambulatory non-invasive machine which is attached to the patient's body, and it will record all the electrical activity of the heart in 24-hour of periods. And if there is any major event or any major thing happens in the heart, like if there is any atrial fibrillation or ventricular tachycardia or any other condition, then it will record that major event, okay. So it is a ECG for 24-hour. Next we have myocardial biopsy. Biopsy means whenever a cell or tissue is taken from the patient's body and it is sent to the lab for the process, for the culture, okay. So here we are taking a cell or tissue sample from the heart, okay, from the myocardium layer. So we are taking a sample of tissue or cell from the myocardium of the heart for checking the structure of the myocardium. Okay, we are checking for any scar formation. Is there any scar formation in myocardium? Why there is any dilation in the myocardium? Why there is restrictive cardiomyopathy is happening? Is there any genetic abnormality in the cell, or is there any abnormality or any mutation in the gene? So through the biopsy we can check for the complete cardiomyopathy, as which type of myopathy the patient is suffering from. And in biopsy also, it also tells about the viral infection. Is there any viral infection the patient is having in his coronary or in his myocardium cells? Next we have transthoracic echocardiograms. So transthoracic echocardiograms tells the posterior region of the heart, how our heart is working in a posterior side, okay. So there are several types of echocardiogram, like we have transthoracic echocardiogram, transesophageal echocardiogram, and there are many more other echocardiograms. So in transthoracic echocardiogram, a scan or a machine, a little machine of a lens is placed into the thoracic region of the patient, and it will give us the clear images of the posterior region of the heart. So these were the diagnosis of cardiomyopathy.